Well, hello, it's Bruce Williams again, and today it's time for Gross Path Challenge number 51. We're going to look at some classic lesions in some older images, but they're still fantastic. Let's go ahead and get out our pens, our paper. Give yourself about 60 to 90 seconds per question, and let's begin. Question number 1, is tissue from a pig? Can you give me a morphologic diagnosis and 2 possible causes? Okay, time's up. These are very discrete, necrotic, or ulcerated area. Remember that when we talk about organs with a mucosal surface, necrosis and ulceration are sort of the same thing. So you could have told me that this, and they're very discrete. These are actually Peyer's patches. We're looking at the colon. These are large colonic Peyer's patches. The appropriate morphologic diagnosis would be multifocal Peyer's patch necrosis. There are a couple of agents that will do this in pigs. When you think about something that really goes after the lymphoid tissue in the gut, first, you want to think of hot gram-negatives. And across species, do the same thing in cattle. Salmonella is one of those bugs that really goes after lymphoid tissue first. Eventually, you'll have necrosis on the mucosal surface, on the absorptive surface, but it starts in the Peyer's patches. Okay, when I think of Salmonella in swine, the first one I'm going to think about is Salmonella cholerae. That's a host-adapted version that causes sepsis. It starts and causes what are known as button ulcers. If you look at these, don't these look like the underside of old-time buttons? So if you said Salmonella typhimurium, I'm going to give it to you. Salmonella typhimurium tends to be, it's non-host adapted in most species. It tends to cause a diffuse necrosis. You don't start out with these great areas of lymphoid necrosis, but I got to give it to you. So either of the Salmonellas I'm going to take. The other one that is classic for starting with Peyer's patch necrosis is porcine pestivirus, or classical swine fever. Also, if you look in the literature, button ulcers are a classic sign for that. Are you ready to move on? Let's move on, but isn't this a great lesion? Button ulcers. Slide number 2 is from a parakeet. This one's a little overexposed, but I think it's a fair one. And a very nice presentation of this particular disease. Can you give me a morphologic diagnosis and the cause? Okay, time's up. Nice little bird, and what we're seeing is crusting over the cere. And if you looked really close, you might see some holes or some broken spots in the beak as well, but it's tough to see. This one's a little overexposed, but the crustiness should sort of jump. This should be nice and smooth, and we have this crustiness right here. This is a very classic lesion in budgerigars or parakeets. The morphologic diagnosis, I would say, is diffuse hyperkeratosis of the cere, C-E-R-E, that's what this little area with the nostrils in it is called. If we looked at this animal, it might also have a similar crustiness on the feet. The etiologic agent is a sarcoptid, meaning it sort of lives in keratin crusts, a sarcoptid mite of cytosines, and its name is Nematocoptes pili. That's P-I-L-A. It has a close cousin which lives in the skin of the unhaired skin of poultry, especially chickens, called Nematocoptes mutans. Both Nematocoptes mutans and Nematocoptes pili give a very similar lesion of hyperkeratosis of the non-haired skin. In the budgerigar, it's the cere and the feet. In poultry, it's usually the feet. You get this tremendous plaques of hyperkeratosis, and if you section those, you will see the mites and their eggs and nymphs, all living in the large plaques of keratin. Now, Necrotic pili will also burrow into the keratin of the beak, which causes weakening of the beak. They drill these little holes and tunnels, and you can have large pieces of the beak break off because of the weakening due to Necrotic pili. I always remembered and remember which was which, because pili is Latin for dart. And I guess if you're going to throw a bird at a board, you'd probably do better with throwing parakeets than chickens. So, Necrotic pili. Let's move on to number 3. This is tissue from a dog. Can you give me a morphologic diagnosis? Okay, time's up. This is a very straightforward one. What we're looking at is we're looking at the kidney. It has been, and here's a ureter here, it has been opened up, and there's really very little left of the medulla and the cortex. Almost nothing. Maybe there's a little rim here of residual cortex with a tremendous amount of fibrous connective tissue. I would imagine if there's any glomeruli there, they're totally sclerotic. What we're looking here is the fibrous connective tissue of the calyces. The pelvis is widely dilated. The dilatation extends down into the ureter. And all I'm looking for is hydronephrosis here. So that's a fairly straightforward one. I could ask you for 3 or 4 or 10 causes. Basically, all the causes have to do with some form of obstruction, whether it is a tumor down in the ureter where it goes into the bladder. Maybe transitional cell carcinoma has blocked it. Maybe this animal had a large stone which is passed in the ureter and blocked it. Perhaps it had a giant kidney worm, Tracunculus insignis, which sort of lives in there, obstructs the flow. The kidney's a weird organ. You would think, as advanced as the kidney is, it would know there would be some sensor that senses obstruction, but there isn't. So if you cut off the outflow, the body's just going to continue to filtrate into there. It doesn't have any feedback mechanism that says, hey, I'm obstructed, let's divert everything to the other kidney. So when you obstruct something, it just the pressure continues to build up. Ultimately, within 3 to 4 days, you'll start to see morphologic changes, which start with necrosis of the renal pelvis due to the increased pressure and the closure of the vasa recta. The changes become reversible within about 3 weeks. In obstruction, people have done the studies years ago with tying off the ureters of dogs and measuring the damage. So it happens fairly rapidly and fairly severely, and obviously this is a very non-functional kidney. Okay, moving on to slide number 4. This is tissue from a horse. Can you give me a morphologic diagnosis and a cause? Okay, time's up on this one. This one's a little difficult to get oriented on, but I'm going to assume that this is a ruler of a foot, which would mean that this spleen is probably a total of 3 feet long. It is much larger than you would expect in a normal horse. Hey, here's another clue right here that a section has been removed, and we're not leaking any blood out of it. Okay, seems fairly firm, fairly dry. So the morphologic diagnosis that I'm looking for is diffuse splenic lymphoid hyperplasia. Okay, if you said erythropoietic or diffuse splenic extramedullary hematopoiesis, I'm going to give that one to you too. I like lymphoid hyperplasia a little bit more, and I'm going to tell you why. But I think there's probably both going on. I can tell you there's both going on because look at these little red dots on the outside of the spleen. When you get a lot of VMH going on in the spleen, like you might see in a very anemic animal, you often will get some exudation and a little bit of accumulation of this tissue on the outside of the splenic capsule. So this is a huge spleen. And when we think about huge spleens, we're going to think of a couple of things. But we have the meaty spleens and we have the bloody spleens. This is obviously a meaty spleen, so I'm not really going to think about barbiturate anesthesia or something like that. In a horse, first thing I'm going to think about, and I think the best answer for this that will cause lymphoid hyperplasia and extramedullary hyperplasia is acute lentivirus infection or equine infectious anemia. Remember that the lentiviruses cause a tremendous proliferation of lymphoid tissue in the early stages. So you would cut into this and you would see all sorts of lymphoid follicles and you wouldn't get a whole lot of blood, even though it's a gigantic spleen. So we wanted the morphologic diagnosis of diffuse splenic extramedullary hematopoiesis and lymphoid hyperplasia. The cause will be equine lentivirus. What are some other things that it could be? And I have to consider my differential diagnosis. If you said this is lymphoma, I'm going to give you 3 or 4. You sort of ignored the little beating of the extramedullary hematopoiesis not the underside, but the outside of the spleen. But I'm going to give you 3 or 4 because, yes, you can get diffuse splenomegaly with lymphoma. Are there other things that would cause that? There are a number of extra or intraerythrocytic parasites like babesiosis that you probably could consider be a little juicier than this, but that's a good thought too. So that one's a little tricky. Hopefully next time you see this, but you can get huge spleens, and don't discount the little beating of splenic tissue that exudes through the capsule as evidence of a proliferative lesion going on inside. Usually a lot of extramedullary hematopoiesis, because I've mostly seen it in foals with anemia due to immune-mediated causes. Okay, slide number 5 is tissue from an ox. Can you give me a morphologic diagnosis? Okay, time's up. Fantastic. Morphologic diagnosis is diffuse, severe, fibrinopurulent epicarditis. Yes, this is hardware disease. Hopefully you looked at it correctly. Sometimes you look at things sideways and you never really get to the point. But this is the heart. This is the atrium here. I think what this represents is this is the peeled back pericardium, because we see the whole heart here. That's why I went with epicarditis. And maybe if you said pericarditis and epicarditis, that's good too. Look at all of this fibrin on the outside, but it's not wispy, nice, wispy fibrin like we often see with septic diseases. This is purulent. If you could smell this, it would smell rotten, like bacteria, and that's exactly what happened. This animal probably ate a piece of wire or metal. They're often 3 to 4 inches long. They are shaped in a form of an L, and during the normal contractions, they accumulate in the reticulum. During normal reticulum contractions, these pieces of wire get to the edge and they're pushed through the wall of the reticulum, either into the liver behind, which we never really ever see, maybe hepatic abscess, but you usually don't see a lot of signs, or they're pushed into the pericardium. And because they have a crimp in them, they don't go all the way through. A straight wire will probably go all the way through into the pericardium, not cause a whole lot of problems. But this one stays there and continues to wick bacteria and maybe some protozoal agents, some ciliates into the pericardial sac, resulting in severe suppuration. There's 2 ways that bacteria get into the pericardial sac. They get into it through the bloodstream in sepsis, but you usually just get straight fibrin. When you have bacteria in there in a big, stinky, pus-filled pericardium, you got hardware disease. You got traumatic reticuloperitonitis, and that suppuration is due generally to direct inoculation into the pericardium. So remember those are good things to remember. Systemic or direct inoculation of the pericardium. Clues you into what's going on in a number of cases. Slide number 6 is tissue from a dog. Can you give me a morphologic diagnosis? Okay, time's up. I've always liked this picture, and I've been using it for about 30 years. We're looking at the back of the eye. What a great picture. Shot underwater here. You can see the bubbles. And you can see that the ventral portion, or at least one portion, if not all of the optic cup, is pushed significantly back. It's a defect. It's not there. And this is known as a coloboma. Colobomas are sort of late defects in the development of the eye. The optic fissure is usually the last part of the eye to develop. It's a slit in the bottom of the optic cup, and if it doesn't close, you get this defect either ventral to the optic cup or involving the entire optic disc. I said optic cup, I meant optic disc, where the optic nerve enters the back of the eye. This causes a lot of problem, especially with the developing retina. Sometimes within colobomas you will see dysplastic areas of retina which also do not develop correctly. Colobomas may be seen in as one of a constellation of defects, which is seen in the Collie eye abnormality with additional scleral and retinal defects, or sometimes they're seen just by themselves with Basenji's having a breed predisposition. As I always look, because people are great at commenting on these and saying, what about this or what about that? Another thing that I would consider in this particular case is severe and prolonged glaucoma. In that you also get elevated pressure causing a dying back of the nerves of the optic nerve, and you have a weakening of structure, and we call that optic cupping. That's what was sticking in my head. We call that optic cupping. You actually get an invagination in the area in which the optic nerve comes in. So I think I would have to consider that as well, but really I like colobomas. Colobomas aren't just restricted to the area of the optic fissure. It's the most common area, and the majority involve the optic disc. But you can see them anywhere. Sometimes they're huge and they're almost as big as the globe itself. So it's a developmental problem, and when you think about colobomas, I want you to think about the Collie eye abnormality. Okay, let's move on. Slide number 7 is tissue from catfish. I want you to give me a morphologic diagnosis and a cause. Okay, time's up. This is a classic disease that goes by the name of hole-in-the-head disease, which is very nonspecific because there's a lot of different diseases in fish that end up being called hole-in-the-head disease. But this one, when we talk about hole-in-the-head disease in catfish, is usually associated with one agent, and that is Edwardsiella ictaluri. There are a number of other Edwardsiella, including Edwardsiella angulare, which is an emerging disease in eels, and there's Edwardsiella tarda, which causes some septicemic diseases, but this is very unique for the catfish, although you can see the same lesion in salmonids as well. And it's a great lesion. You have to know something about the disease before you know how this lesion is made. And this is actually, the morphologic diagnosis is a focally extensive necrotizing cranial osteomyelitis with overlying dermal necrosis. Okay, basically, unlike most bacterial infections of fish, which start with damage to the skin and scale and then come from the outside, this is a septicemia. Edwardsiella causes septicemia, as we mentioned, and the bacteria will localize in the bones of the head, and they eat their way out. So this is an inside-out lesion, not your typical outside-in lesion That's why, for some reason, it's always in the same spot. And very classic. This is one of the classic diseases of fish. If you're taking your certifying examination, you really need to know this one. There aren't that many pictures out there. I keep seeing the same ones over and over, and this is pretty commonly used. So, Edwardsiella ictaluri, hole in the head disease. I think there's another hole in the head disease in Oscars, but it's not caused by this. It's caused by some other things. Are you ready to move on? Absolutely. We have slide number 8. This is from a New Zealand white rabbit. Oh, I gotta give you something. How about a morphologic diagnosis and a cause? Okay, time's up. Well, we have a lot of bumps on this animal. We have bumps underneath the skin, the nose is swollen, the eyes are swollen. I can see that there are bumps and swelling and redness of the ears. And this is a condition which is known as myxomatosis. Myxomatosis is not natural in laboratory rabbits, which are of the genus Oryctolagus. It is most commonly seen in Silvolagus, which are the nice eastern cottontail that we see in this, or the small brown bunnies that you see around the world. It's a viral disease. It's spread by Leporopox virus, a virus which also causes localized fibroblast proliferations called Shope fibromas, causes fibromas in squirrels, but some strains in rabbits cause a devastating disease called myxomatosis, which wipes out large numbers of wild rabbits when it's introduced into a naive population. It's probably a 90% plus mortality. The other 10% that can survive, that are resistant, provide protection. It selects for them, and usually you get periodic outbreaks, maybe every 10 or 15 years. And that's Silvolagus rabbit. It hits the Oryctolagus even harder. The lesions are very much the same. Morphologic diagnosis is diffuse fibroblastic proliferation with myxedema. And if you take a histologic section, you are going to see within the really ooey gooey subcutis, you're going to see large fibroblasts which have pox viral inclusions. See, it's sort of the same thing with Shope fibromas, except you also see pox viral inclusions in the epidermis, and Shope fibromas, you don't see it here. Now, you would think that these animals, they got sort of ooey gooey skin and they should be able to survive. But they're usually dead within 5 or 6 days. There is profound immunosuppression in these particular animals, and a lot of things go haywire. This disease was released in Australia to try and control the local rabbit population. What they succeeded in doing is actually killing off a lot of rabbits, but now they have a myxomatosis resistant population. So it's not a long-term solution. But just remember, Silvolagus get it, and it kills them, but it really lays waste to the Oryctolagus. Slide number 9 is tissue from an aborted lamb. Can you give me a morphologic diagnosis and a cause? Okay, time's up. This is a classic lesion in ovine abortuses. These targetoid areas of necrosis in the liver are generally associated with Campylobacter foetus, subspecies foetus. There are a couple of other possibilities. If you said Flexispira rapini, I'm going to take that one. I've never actually seen it, but I'm going to take that one. And Campylobacter foetus in the ruminant is transmitted by ingestion. There's an aborted fetus, there's a placenta, associated with it. Of course, all the sheep have to come over and they got to sniff it and they got to nibble it. And so all of they can also pick it up from vaginal discharges or feces as well. In small ruminants, it's exclusively transmitted, generally by ingestion. It doesn't cause systemic disease in the mom, and only a mild placentitis, but eventually placental becomes insufficient, and you get abortion in the pregnant ewes that have come in contact with it. In cattle, there are two different forms. They do have a Campylobacter fetus. They also have Campylobacter fetus subspecies venerealis, which may be transmitted to cattle from infected bulls. The agent lives in the crypts of the penis and is transmitted venereally. But when you think about in sheep, it's pretty much this orophycal or oral placental transmission. So, great lesion, Campylobacter fetus or Flexispira rapini is what I'm looking for here. Okay, let's end this Gross Path Challenge with a classic lesion. This is tissue from an ox. I need a morphologic diagnosis and two possible causes. Okay, time's up. Morphologic diagnosis is a focally extensive or bilaterally symmetrical, I'm fine with either of that, necrotizing laryngitis. Hey, the name of this disease is necrotic laryngitis, and the two classic causes are Fusobacterium necrophorum or Histophilus somni. This is a disease that's often seen in the feedlot. It's seen in young calves. The cause is not especially known, but see, normally these two areas near the arytenoid cartilages are very close apposition. And a lot of times, this is the first time the animal comes to a feedlot, and it gets infected with a variety of viruses that it's never seen before. It's part of the bovine respiratory disease complex. And then coughing, repeated coughing will cause these areas to rub together and you'll get some ulceration. Remember that Fusobacterium necrophorum is a common inhabitant in all cattle of the oral cavity. We see a lot of necrotizing lesions after ulceration of the mucosa. You can also see it in the respiratory. And then it sees that little ulcer and it's going to colonize it, causing this large necrotic lesion. Staphylococcus somni is usually in every feedlot as well. It is one of the lesser known manifestations of a Staphylococcus somni. The one that we see a lot more nowadays is the pneumonia. But if you give it a foothold in an ulcerated lesion, you can get this large necrotizing lesion. As we said before, it's called necrotizing laryngitis, and very classic location, very classic appearance. Dr. John King used to say that it was due to these young calves being collected, put in a feedlot, and crying for their mama all night long. Hey, that's a good theory. I like the one about subclinical infection and coughing with bovine respiratory disease complex as a slightly better cause, but nobody really knows for sure. Okay, well, brings us to the end of this particular exam. I hope you enjoyed it, and come back often to the Foundation's Facebook page, YouTube channel, or the Joint Pathology Center's video library, where all of these videos will reside. I hope you enjoyed today's challenge, and I hope you come back often for other Gross Path challenges. Y'all have a good day now.